My magnificently irregular disciples, you survived fibrillation's chaos, now endure its sibling, atrial flutter, less chaotic, more cult-like. Think of it as AF's little brother who found structure, a re-entry circuit, and decided to cosplay as a chainsaw. Etiology. Who invited this DJ? The atria run circles, literally. A re-entrant loop around the cavatricuspid isthmus in the RA sparks the flutter frenzy. Risk factors? The usual cardiac villains: old age, sagging conduction cables, structural heart disease, weak walls, more loops, hypertension, constant stress test, diabetes, sweet poison. AF history: big brother drags lil bro into the mess. Mnemonic: old hearts don't dance. Old age, heart disease, structural IHD, HF, diabetes, debt to AF, history. Compared to AF's rave, flutter is a line dance, predictable, still deadly. Pathophysiology, the sawtooth symphony. Re-entrant circuit loops the RA like a cursed carousel. Atrial contraction speed, 250–350 BPM. Ventricles, protected, sort of, by AV node, usually 2.1 block, 150 BPM. Still, efficiency plummets, atrial kick gone, cardiac output sulks. Knock knock. Who's there? Saw. Saw who? Sawtooth waves carving your ECG. Clinical features: how flutter flexes. Palpitations feel like a machine gun in your chest. Dyspnea, fatigue, dizziness, and syncope indicate the heart is saying, output not found. Chest pain mimics ischemia, like a fast-rate cosplay. Heart failure symptoms such as orthopnea, paroxysmal nocturnal dyspnea, and edema can occur if there is underlying left ventricular dysfunction. There is also a thromboembolic risk because left atrial stasis breeds clots, which may lead to stroke, transient ischemic attack, or limb and gut ischemia. Here's a villain roast. Flutter when your atria are consistent, but consistently wrong. Mnemonic to remember these features is PDOX, palpitations, dyspnea and fatigue, output failure including syncope and dizziness, chest pain, and stroke or thromboembolism. Investigations: spotting the chainsaw. Using a 12-lead ECG, you can observe sawtooth flutter waves, best seen in leads Tsakun, A3, and AVF. The atrial rate ranges from 250 to 350, while the ventricular rate depends on the AV block. An echocardiogram helps detect structural disease, thrombi, and assesses atrial size. Laboratory tests including TFTs, renal function, and electrolytes help to find triggers. Remember the mnemonic, see the flutter. Sawtooth ECG, echo. Exclude triggers with labs. Management, how to declaw the beast. Rate control involves V-blocker, CCB, or digoxin for sedentary patients. Rhythm control, electrical cardioversion often works better than AF. Antiarrhythmics include amiodarone and others. Ablation, specifically cavatricuspide isthmus ablation, can be near curative. Anticoagulation follows the same CHA2DS2 VASC rules as AF. Stroke risk doesn't care if you're sawtooth or chaotic spaghetti. Here's a pickup line. Are you an ablation? Because you complete my circuit. Complications. Flutter's legacy. Heart failure worsening leads to less atrial kick and tachycardia-induced cardiomyopathy. Stroke or systemic emboli can affect the brain, limbs, or mesentery. Sudden instability can occur, as fast ventricular rates may mimic atrial fibrillation's chaos. Remember the mnemonic FHS. Failure for heart failure, head for stroke or transient ischemic attack, and shock for instability. My devoted rhythm junkies, remember, Flutter is AF's organised sibling, still chaotic, just better at matching outfits. Spot the sawtooth, block the rate, burn the circuit, and never skip anticoag. Because the only thing sharper than those ECG waves is your examiner's glare if you forget. Now, leave me your wildest rhythms below, for I shall roast 3 comments in the comments section.